Preeclampsia. It is a serious condition that occurs in about 1 in 20 pregnancies. Now, women with this condition, they develop very high blood pressure that can result in serious, even life-threatening complications for the mom and for the baby. It is usually diagnosed in the 3rd trimester, that's after 34 weeks, but the FDA has just approved a test that can identify the risk of preeclampsia in the 1st trimester. Our KSTP health expert, Dr. Arkel Georgiou, is here to explain all of this. And Arkel, we are so glad that you're here. Let's start with a little bit more about what preeclampsia is.
Right. Well, as you said, it is a serious complication that can occur in pregnancy. And while on average it's diagnosed at about week 34 of pregnancy, it can start as early as week 20. And it can actually also start as late as 4 to 6 weeks postpartum. That's rare, but it can still happen. And when someone has preeclampsia, they have high blood pressure plus signs of additional organ damage. What does that mean? It means they might have protein in their urine. They could have other signs of kidney damage, lung damage, other nervous system. When it gets to a serious stage, women can have seizures. They can have bleeding complications. The baby can be born prematurely. It is the leading cause of maternal death. And what's scary about it, Paul, is that women don't have any early symptoms. Most women don't have early symptoms until they have serious symptoms. And since a risk factor is your first pregnancy, you really don't even know to be aware.
Oh, wow. And so many times it's late in the pregnancy, but this new test, it can identify this early. So what is the benefit of it?
Yeah, so this is a new test. So there have been tests that doctors are screening for this all the time. Let's just be really clear. They're always checking pregnant moms' blood pressure. But the tests that have been available have only been for moms that are high risk, known to be high risk, or already have preeclampsia, or later in their pregnancy. This test is one that can be done on all pregnant moms. It's done between 11 and 14 weeks of pregnancy. And what it does is test for 4 different biomarkers or factors in the blood that get elevated before the mom develops any symptoms, any high blood pressure at all. So it can really give you an early sign that you're at risk, not diagnostic, but you know to be aware because you're higher risk. 90% sensitivity, and that's double the sensitivity of what doctors can do today.
Yeah, that's important to know all of that. So if you are at a high risk, what's the treatment for it?
Well, what to do if you're high risk is that it could just change your entire course of prenatal care. Your doctor may want to see you more often to make sure your blood pressure is normal. You may want to be checking your blood pressure at home so that you can monitor it. There is a well-accepted recommendation that women who are at high risk for preeclampsia start taking a baby dose aspirin at 12 weeks, but if you don't know, you can't even take it. So this would allow women as early as 12 weeks to start taking that prophylactic aspirin and just being more aware of the symptoms. One of the early symptoms could be that you have a headache, but when you're pregnant, you don't feel good, right? So you could blow off a lot of symptoms. This might make you aware.
So, I mean, all this sounds really straightforward, but is there a controversy about it, though?
There's always controversy, isn't there? This is the one that I think we should focus on and the one I'm reading most about, which is that this test is new, unclear whether it's going to be covered by insurance. It's going to cost about $240. And the controversy is about making this available to all women because women that are most at risk for preeclampsia are Black women and women who are in underserved minority groups. So let's make sure that not just those who can afford it get it, but everyone can get it. And that's really where there's a lot of discussion.
Oh, yeah, important information. Okay, Dr. Arkel Georgiou, thank you very much, and we'll be right back.